Hello, this is the Just the Talk YouTube channel where I'm going to talk something which is becoming more and more common. Many states have started legalizing use of marijuana or pot smoking for medicinal purpose, and one does not need to have significant health history to do that. The recreational use of pot or marijuana is already there for thousands of years or many years. It was considered as illicit drug use. However, with legalization of anything, the use increases. In some of the states in the early part when the things were legalized, approximately 8% of the people were using it. It is estimated that now overall the use of smoking pot or use of marijuana product might be as much as 15%, which will lead to about 25 million people in US itself using it. Some estimates say that the use of marijuana may be as much as 200 million people in the world. Now again, whether we're not talking about legal, we're not talking about ethical, we're not talking about theological or religious, whether you really need this stimulant or not, but we're talking about the medical part of use of marijuana. Since it has been legalized, it is approved for resistant muscle spasms, seizure disorders, chronic pain, and many other conditions where I think use may be at best iffy, at worst too much. But it has been used. So once we know that it is used, the medical profession and the families and relatives should understand the side effect of this. Of course, people that actually use it know about it, but there are a couple of different receptor sites that the pot smoking affects. The neurological one, which is type 1 receptors, and the type 2 receptor are peripheral. Marinol, which is a prescription drug, was and is available for use as a prescription drug for appetite stimulant and other things. And this has been there for a while, so it is not that we did not have a tablet form of marijuana for medical purpose only. But nowadays people are using it in various forms, including gummies and CBD oil. The CBD oil, interestingly enough, does not contain, repeat, CBD oil does not contain THC, which is the ingredient which causes the various side effects that we know of. So I'm going to talk briefly about smoking pot and what can it do or how can it affect medical decisions and medical problems. Because nowadays, as much as we talk about use of drugs, we don't necessarily consider smoking pot as an illicit or illegal drug use like cocaine, heroin, fentanyl, used for non-medical purposes. So acute ingestion, acute toxicity can cause severe nausea, vomiting, and altered mental status. Everybody knows about it. And these are effects related to the neurological effect or neurological receptor, which is one, CB1 receptor, cannabinoid receptor 1, which are in the nervous system. CB2 are the receptors in the peripheral system. History of using smoking or taking by any other means of these products is very important simply because it will tell you certain things about a patient, either when you are treating him or otherwise. For example, these receptors, there is a cross tolerance. That means if you are smoking pot or if you are taking it by any other form, it also uses similar receptors to other drugs, which are pain medication drug as well as benzodiazepines. Benzos are like Valium or Versed or Xanax. These are the medications, they have a cross tolerance when you're smoking pot. So if somebody is using marijuana product, he has increased tolerance to the use of Valium type of drugs, Valium, Xanax, Ativan, lorazepam. These are the products which is benzodiazepine originated product because the receptors that he uses are similar. Same thing happens with narcotic use. So there is a cross tolerance between these drugs and one has to be careful. So if you are prescribing somebody anti-anxiety medication or pain medication, and if they are smoking pot, they compete with each other, and that causes cross tolerance, which can become a problem. Now, as far as the other systemic problems are used, when you smoke, any smoke is bad. You've seen that smoke from fire, smoke from wood-burning stoves, to smoking pot or tobacco can cause airway sensitivity, swelling, and reactive airways, or acting like having an asthma. So airway sensitivity, swelling, etc. is important when one is taking or smoking pot, and that can make asthma worse. Or if you're undergoing a anesthesia and need to be intubated, you may have issues related to the airways. The smoking pot also increases the heart rate. So a lot of people who have been smoking pot regularly, their baseline heart rate is increased, and their acute ingestion, either smoking or taking it in any other way, can also increase the heart rate. Irregular heartbeats, extra beats, atrial fibrillation, and even in acute situations, sometimes a heart attack can also occur related to cannabinoid products. Again, this is not as common, but some people say after ingestion of significant amount of smoking, within 60 minutes, there's an increased risk of having a heart attack. Even the heart blocks can also occur related to same product. The metabolism of these drugs, i.e. the metabolism of product from the smoking cannabinoid or pot, marijuana, uses similar enzyme in the liver, and many drugs that also use the same pathway in the liver for metabolism of these drugs, like blood thinner called Coumadin or warfarin. So if somebody is regularly smoking or taking these drugs, the competition between the enzyme causes Coumadin effect to get worse. So the chance of bleeding related to blood thinner or anticoagulation will increase. Same thing holds true about many other drugs, including non-steroidal anti-inflammatories, including Plavix, which is another antiplatelet drug, which is used after stents, after strokes, after cardiac issues, to prevent the reclotting. Again, that will be interfered by use of smoking. So again, the incidence of bleeding related to blood thinner or medications that prevent clumping of platelets, like Plavix, which is used to prevent the clotting or clogging of the stents or prevent the stroke, would also get worse. So one has to be very careful because the metabolism is interfered with smoking of the pot. So whenever somebody has these problems like atrial fibrillation or TIA, transient ischemic attack, or stents in the heart, and they want to smoke, there is a risk because the heart rate increases. They can have irregular heartbeats like atrial fibrillation, extra beats, as well as if they are on blood thinner, then the metabolism is such that you have a high risk of bleeding. So if anybody who is using these products should inform their physician and be careful in using it because it has cross sensitivity with narcotics Valium type of drugs, and also interferes with these blood thinners. So one has to be careful. Last but not the least, CBD oil. CBD oil does not contain THC, which is the main ingredient in the pot smoking or marijuana, which gives you the kick and the side effects. So it is a little different, but regular pot smoking has its own side effects and can take toll. Thank you for watching. If you like it, please subscribe. Thank you. Have a nice day.